Traditionally, medical and surgical interventions have been the major focus for patient care, with predominant focus on providing best-in-class products and training to surgeons to help them serve patients better. And the medical device companies were more of product suppliers, catering to needs of surgeons and hospitals. But today, the focus of healthcare delivery should be around the patient. The intervention which happens in an operation room is just one aspect of continuum of care. And to understand the journey of a patient, let's go back in the past. The patient traverses a long journey in what we term as the care pathway, and very few in this journey get desired results, which is better patient outcomes and improved quality of life. One of the key stages of this journey is the patient with symptoms. Patient with symptoms reaches out for help by several ways. Reading something on the internet, through an interaction with a family or a friend, or as simple as visiting a mall and there is an interactive iPad on which they see some information on an issue or a disease. However, despite the symptoms, there is still a significant set of population who are inadequately screened and diagnosed for a disease, leading to a significant dropout of patients. The common reasons for not getting a proper diagnosis are the doctor and general practitioner inadequately trained, lack of proper referral, lack of cost-effective diagnostic tools. Here's a fact for you. Did you know that in Asia, approximately half of the patients who have atrial fibrillation are yet to be diagnosed, and they end up being diagnosed very late in the disease? 44% of the diabetes population of Asia Pacific is still undiagnosed. A fraction of patients who are screened and diagnosed are offered treatment options. Once the doctor confirms the problems, a patient will choose an option to proceed further, like medication. A lot of people feel it's better to go on medication than to do a surgery. Surgery. A lot of people run away after seeing the surgery costs. Alternate medicines. Try Ayurveda, Chinese medicines. He or she might even decide not to proceed with any treatment because they can't afford it or they feel it's too late to do anything. There are numerous dropouts at the diagnosis stage, and the common reasons are patients diagnosed very late in the disease stage with very little options, affordability, reimbursement issue like insurance not covering the disease, capacity issues. While inadequate diagnosis and treatment poses a major challenge, there is a greater challenge in the very first aspect of a patient journey, which is significant. We call it a disease prevalence. The unaware population who either have the disease or are at high risk of contracting the disease. There is a significant challenge at this level, and it is a major bottleneck for patients. Did you know that in Asia, only 2 out of 10 people who are at high risk for colorectal cancer are screened at regular intervals? Many of these patients don't move to the diagnosis or the screening stage because of lack of awareness, affordability, or as simple as lack of healthcare infrastructure. Wait, did you think this is it? Not really. There is a final stage of the care pathway, what we call a disease management. What happens in the patient journey has an impact at the final stage, which is post-operative care and disease management and outcomes. A significant number of patients who have had intervention go home and are compliant to doctor's instructions. And at the same time, there are many patients who are not compliant. Across the world, only 6 out of 100 people who are diagnosed at stage 4 of colorectal cancer are alive at the end of 5 years, as compared to 74 patients in stage 1. A healthcare company should look at all the 4 stages. There are multiple barriers and bottlenecks that exist at each stage. Opening up these bottlenecks will provide healthcare to a larger group of people. Disease state insights are the way forward, and that is what we know at Johnson & Johnson, as caring for the world, one person at a time.